Hello, everyone, and welcome to the seminar about the Johns Hopkins Medicare Advantage plans from the Johns Hopkins Healthcare. The Johns Hopkins Advantage MD and MD Plus and Advantage AHMO plans are for Marylanders who live in these counties: Anne Arundel, Baltimore, Carroll, Howard, Frederick, Somerset, Washington, Wicomico, and Worcester counties. If your county is not listed here, please call 866-324-9820 to speak to a Medicare specialist. We're going to spend a little bit of time talking today about your eligibility, how Medicare works, and how to choose the right Medicare Advantage MD plan. Medicare is a federal insurance program that pays for hospital and medical care. In order to qualify for Medicare, you need to be a U.S. citizen or resident and be age 65 or older, or be under age 65 and permanently disabled for 24 months, or be living with end-stage renal disease. For those of you who haven't already done so, enrolling in Medicare is very easy. If you're already receiving Social Security benefits before you turn 65, you won't need to file a Medicare application. You'll automatically receive your Medicare card 2 months before your 65th birthday. If you don't already receive Social Security, you may apply for Medicare at any Social Security office or by calling 800-772-1213 or visiting their website at ssa.gov. To join our plans, you must have Medicare Part E, Part A, and Part B, and your permanent residence needs to be in one of our service areas. Starting this year, we will be able to accept people with end-stage renal disease. Now, before we get into our new Medicare Advantage plans, let's take a look at Medicare, what it is and why you need it. Let's review what we call Medicare basics together. For some, this may be new information. For others, just a review. There are several different Medicare enrollment periods that you should be aware of. When you're first eligible for Medicare, you have a 7-month initial enrollment period to sign up for Part A and or Part B. If you're eligible for Medicare when you turn 65, you can sign up during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and 3 months after the month you turn 65. The annual enrollment period takes place between October 15th and December 7th every year. During this time, anyone with Medicare can join, switch, or drop a Medicare Advantage plan. Changes are effective on January 1st of the following year. The open enrollment period, which takes place between January 1st and March 31st of each year. This time period allows individuals enrolled into a Medicare Advantage plan to make a one-time election to go to another Medicare Advantage plan or back to original Medicare. If you have a special circumstance like moving to a new area, losing your employer coverage, group coverage, and anything like that, you may be able to sign up for Medicare during a special enrollment period, also known as an SEP. The federal Medicare program is made up of 4 parts that help you cover specific services. Let's take a look at those parts one by one. Medicare Part A is hospital insurance. It helps pay for inpatient care in hospitals and skilled nursing facilities, for hospice care, and for home health care. Part A is free for most people. However, there is a deductible per benefit period. Medicare Part B is medical insurance. This is optional coverage that helps pay for doctor services and other medical services. It includes durable medical equipment such as wheelchairs or walkers, and many preventable services such as vaccines and yearly wellness visits. There is a premium for Part B that varies for higher income consumers. Together, Part A plus Part B is called Original Medicare. For most items, Medicare covers 80% of your cost. You pay the other 20% but only after the annual deductible is met. So you might be wondering, why would you need insurance if you already have Medicare? That's a good question. Original Medicare was never meant to cover all your healthcare expenses. So many people enroll in a Part C or a Part D plan to cover benefits that original Medicare doesn't or won't help pay for some of the costs. Medicare Part C is known as a Medicare Advantage. These are private health insurance plans that combine hospital care, doctor visits, and outpatient care into a single plan. To enroll in Part C or Medicare Advantage plan, you must qualify for Medicare Part A and be enrolled in Medicare Part B and live in the plan service area. Medicare Advantage plans offer an alternative to original Medicare. If you enroll in a Medicare Advantage plan, your Medicare benefits are managed by the plan you join. These plans provide all Part A and Part B benefits and help offset costs like the Part A hospital deductible and the 20% of the cost that Medicare does not cover. Members' copays and coinsurance vary by the plan. Many Part C plans may also include Part D prescription drug coverage, plus many extras such as fitness and wellness programs and supplemental coverage for vision, dental, and hearing. This means you have one plan and one card for your medical needs. Which brings us to Medicare Part D. Part D plans help pay and cover the costs for prescription drugs. Let's take a closer look. The federal government designed Part D to serve as insurance to help Medicare participants with the cost of their prescription drugs. Part D enrollment is a voluntary benefit and is not required. It serves as catastrophic coverage for those who have higher prescription drug costs, and it helps keep the cost manageable for those with lower prescription expenses. Over the next few years, those involved with Part D will be doing even more to provide opportunities to save by reducing the coverage gap. Before we get into too many details, let's talk about how you get Part D. There are two ways to get Part D coverage. You can enroll in a Medicare Advantage plan that includes medical and prescription drug benefits, or you can join a standalone drug plan that covers only prescription drugs. If you're considering a Medicare Advantage plan that offers Part D coverage and you want drug coverage, you must get it through the plan. You cannot join a standalone drug plan if you're enrolled in a Medicare Advantage plan that includes a prescription drug benefit. Or if you're already in a standalone drug plan and you enroll in a Medicare Advantage plan that has a Part D prescription drug offering, you will be automatically disenrolled from your standalone drug plan. Part D has 4 phases. It has deductible, initial coverage phase, coverage gap, and catastrophic coverage. These numbers are for 2022 per www.cms.gov. The deductible phase. You'll start the year in the deductible phase. The deductible is the amount you pay before your insurance kicks in. The deductible is set by Medicare and can change from year to year. During this phase, you pay the full cost of your prescription drugs included in the formulary until your costs reach your annual or yearly deductible amount. This phase ends when you reach your deductible. The next phase is your initial coverage phase. Once you've met your deductible, you move into the initial coverage phase. During this phase, you and the plan each pay a portion of the cost of each prescription drug included in the formulary. Keep in mind that some plans have fixed copays for each prescription rather than a percentage. You're in this phase until your year-to-date costs paid by you and the plan combined reach the initial coverage limit, or ICL. If you reach your ICL limit, you enter the gap, the coverage gap. The coverage gap, or the donut hole, as some call it, is the next phase. In the past, you would have had to pay all your costs at this phase out of your own pocket. For 2022, you pay 25% of brand name drugs and 25% of generic drug costs. If you reach your coverage gap limit, you move into the final phase, which is the catastrophic phase. If your total out-of-pocket spending on prescription reaches $7,050 for 2022 and the year's not over, you move into the catastrophic phase for the rest of the year. You pay very little for your prescriptions, either 5% or $3.85 per generic and $9.85 per brand, whichever is higher. The plan pays the rest, unlimited until the end of the calendar year. People with limited incomes may qualify for help to pay their prescription drug costs through the federal and/or state government. If you qualify, you may receive help with your drug costs, including monthly prescription drug premiums, co-pays, co-insurance, and deductibles. Keep in mind that any extra help you'll receive will only apply to the Part D prescription drug portion of your premium and not the Part C medical portion. The income limits and the amounts of help you receive may differ depending on your yearly income. So to qualify, you may qualify, but you won't know unless you apply. You can get a complete application for extra help by going to www.ssa.gov. So when you're choosing a plan, you have to consider your own personal needs. You want to take a look at the cost. How much will you pay for the premiums, deductibles, co-insurance, and co-payments? Take a look at the benefits. Are prescription drug benefits or any other benefits you might need covered? You need to take a look at your doctors and hospital choices. Do the providers you prefer accept the plan? Your health history. Do you have a chronic condition? Will your healthcare needs need to change in the future? Convenience. Are the plans providers easy to get to? Can you get your prescription and supplies through the mail? These are all very personal choices that you have to make when choosing a plan. So now let's talk about the Johns Hopkins Advantage MD plans. But first, you might be asking yourself, why choose a Medicare Advantage plan in the first place? Advantage MD plans cover your Medicare hospital and doctor benefits, provide prescription drug coverage, and give you that extra benefits all in one plan. Both plans include coverage for preventative care, hearing, and vision care. We've improved our benefits this year and feature an optional comprehensive dental and fitness package and exciting hearing aid benefits. Let's look at some of the unique advantages of our Advantage MD plans. First plan we want to talk about is the HMO plan, which stands for the Health Maintenance Organization. In an HMO plan, you receive most of your care from your in-network primary care physician. If you need the help of a specialist, you would first see your PCP, your primary care physician. He or she would provide a referral to a specialist within the HMO network. If you use providers that are not in our network, the plan may not pay for these services except in emergency situations. The next plan is our PPO plan. PPO stands for Preferred Provider Organization. Unlike an HMO, a PPO plan offers you the freedom to receive care from any provider, in or out of our network. This means you can see any doctor or specialist or use any hospital. However, if you use providers not in the network, you may pay more for covered services. If you need to see a specialist, you do not need to first consult with a primary care physician. No referrals are required for any doctor, specialist, or hospital. For this year, our Advantage MD plan has very low copays and a reduced out-of-pocket cost. Visits to your primary care doctor are zero copay. You also have coverage for routine podiatry, eyewear, hearing aids, and post-discharge meals delivery service. Again, these are all in-network costs. Out-of-network costs are 100% your responsibility. A more detailed description of the benefits is listed in our summary of benefits, as well as our evidence of coverage and they are available online. Please remember that referrals are required for all specialist visits. Medicare covered acupuncture is also included, which is specifically for treatment of chronic lower back issues. Primary care and specialist visits are the same, cost sharing in person or via telehealth. There are no restrictions as to where you can access telehealth services. So let's talk about the PPO plan. We're going to go through the plan options. For the Advantage MD PPO plan, your monthly premium is $90 and your visits to the primary care doctor are $5. Medicare covered acupuncture is also included, which is specifically for the treatment of chronic lower back. Primary care physician and specialist visits are the same, cost sharing in person via telehealth. There are no restrictions as to where you can access telehealth. The co-pays listed are for in-network services. If you want to go out of network, you'll still be covered, but your costs may be higher. For example, if you see a specialist, you pay a $50 copay in network. For a complete breakdown, please refer to the summary of benefits and the evidence of coverage. The next plan we want to talk about is our PPO Plus plan. That also has lower copays and lower out-of-pocket costs. Visits to your primary care provider is a zero copay. You also have coverage for chiropractic visits, hearing aids, and a membership in our Silver and Fitness program. The costs shown here are listed or in-network costs. Out-of-network costs may be more and are listed in our summary of benefits and evidence of coverage. Medicare covered acupuncture is also covered in addition to the acupuncture allowance. The Medicare covered acupuncture is specifically for the treatment of chronic lower back, and there are no injury or illnesses restrictions when using the acupuncture allowance. Primary care visits and specialist visits are the same, cost sharing in person or via telehealth. There are no restrictions as to where you can access telehealth. So let's take a little bit of time and compare the plan options. The main differences are premiums, primary care physician copays, and the additional benefits beyond Medicare. Again, these costs are for services furnished by in-network providers. Costs for services furnished by out-of-network providers may be higher for the PPO members and may not be covered for the HMO members except in emergency situations. The provider and pharmacy directories list all the plans, in-network providers, and pharmacies. You can also visit our website for the most up-to-date listing. Johns Hopkins Advantage MD plans have a robust formulary and cover prescription drugs both through retail and mail order. A list of the covered medications can be found using our plans formulary or online at www.hopkinsmedicare.com. The formulary includes information on restrictions, limitations, and transition coverage. As part of our commitment to keeping everyone healthy and staying healthy, Advantage MD plans include coverage for preventative services, from annual wellness checks up to immunizations, preventative health screenings, and more. You can enroll in these special nutrition, education, and smoking cessation classes if you want. As an Advantage MD member, you'll have access to our 24-hour nurse hotline, where you can call and speak to a nurse day or night with any health questions or concerns you might have. You can even get appointments set up with the Johns Hopkins specialist through our Hopkins Specialty Appointment line. Now let's talk a little bit about the Johns Hopkins Advantage MD difference. The Advantage MD includes a dedicated care team made up of primary care physicians, specialists, and other healthcare professionals. Our goal is to provide preventative, transitional, and complex chronic care. Our approach is holistic. Your dedicated care team can help you with consultations, appointments, treatment, medication, health education, and condition management strategies. Here's another way we're working to help you stay healthy. We offer the Silver and Fitness program available for purchase with the Advantage MD, HMO, and PPO plans. Work out in one of our designated fitness facilities or work out in the comfort and privacy of your own home. It's up to you. These benefits are included in the Advantage MD Plus plan at no additional charge. Johns Hopkins also covers through True Hearing 2 hearing aids per year when purchased through True Hearing. You pay $699 or $999 per hearing aid for up to 2 True Hearing advanced or premium hearing aids every year. 1 ear per year. 1 year follow-up visits with True Hearing provided for fitting and adjustments of the hearing aids. You get your risk-free 60-day trial period, 80 free batteries per non-chargeable hearing aids, and a 3-year manufacturer's warranty. We also offer an optional supplemental dental package for comprehensive dental services. This coverage is beyond preventative dental services such as cleanings, exams, and x-rays, which are included in your plan already. This optional coverage is available for an additional monthly premium. The comprehensive dental benefit is available for purchase with the Advantage MD HMO, PPO, and PPO plans for an extra $25 a month. Johns Hopkins MD is a Medicare Advantage plan with a Medicare contract offering HMO and PPO products. Enrollment in the Johns Hopkins Advantage MD, HMO, or PPO plans depends on contract renewal. This information is not a complete description of benefits. You can call 1-866-324-9820 for more information. You must continue to pay your Part B premium. Out-of-network, non-contracted providers are under no obligation to treat Johns Hopkins Advantage MD members, except in emergency situations. Please call our customer service number or see your evidence of coverage for more information, including the cost sharing that applies to our out-of-network services. Johns Hopkins Advantage MD PPO and Johns Hopkins Advantage MD HMO comply with applicable federal civil rights laws and do not discriminate on the basis of race, color, national origin, age, disability, or sex. Johns Hopkins Advantage MD does not exclude people or treat them differently because of race, color, national origin, race, disability, or sex. Johns Hopkins does offer some foreign language assistance if necessary. We've reached the end of my presentation. Thank you very much for your time. If you're ready to enroll, you can give us a call at 1-866-324-9820 to speak with our enrollment specialist. You can also visit us online at www.hopkinsmedicare.com and select Enroll Now on the homepage. Thank you very much for your time.